First of all, I just want to thank the Labour Party and Duncan Smith for bringing forward this very important motion. I really welcome the opportunity to talk about children's autism and disability services, but it's also a sign of a failed government policy that we have another motion on this topic. Opposition parties keep having to put forward motions on disability services, in particular children's services. Parents of children and adults with disabilities are one of the groups, and I think all TDs will say this, that I meet most frequently. They're often the most at their wits' end, beyond angry and frustrated, and all they actually want is the basic services that their child is actually entitled to. It's literally the bare minimum. Under the Convention of the Rights of People with Disabilities, each child has the right to appropriate healthcare, education, and supports that will help them live independent lives in their community. Moreover, therapeutic interventions are crucial for children. They can be literally life-transforming. That's why it's such a significant and emotive issue, and parents and families know the difference that timely therapies can make. We all know the importance of early intervention. Another motion on this topic is necessary. This area is too important to let slip, and I accept that the Minister is pushing for change, but this change needs to be a priority for all of governments, the Department of Health, Children and the HSE. The recent report from FUS, everyone will know Families Unite for Services and Support, has key points that are extremely relevant for this discussion. Their survey of parents, carers, guardians and clinicians, therapists, everyone, revealed that 97% identified staffing, recruitment and retention as a vital threat to the success of service provision. Disability services have been described as disjointed, diluted, clinically unsafe for staff and users. These findings are stark, but they're also unsurprising. We've had report after report after report from disability organisations which have had similar results. For example, an As I Am survey from 2 years ago found that 54% of respondents felt very dissatisfied with the support services from the HSE for their autistic children, with as many as 65% going on to express dissatisfaction with the broader disability services. Progressing disability services is currently not working. There's no other way of saying it. There are over 4,600 children on waiting lists for assessment of need, and over 10,000 waiting over 12 months for initial contact with Children's Disability Network teams. Then there is the issue of geographical lotteries with considerable variations in services, qualities and waiting list. One example. Figures from December show that CHO4, the Cork Kerry region, has a list of 1,488 children waiting over 12 months for initial contact, while in this category it was 186 for the North West area and 80 for Mayo, Galway, Roscommon. Then there are the larger differences at local level, with Carrigaline, Kinsale, Bandon, CDNT having the largest waiting list in the Cork Kerry region at 331 in total, 316 children waiting over a year, while in contrast the West Cork team had a waiting list of 10, all of whom were only waiting under 3 months. None of this is the fault of the individual teams. The clinicians, the therapists and others on teams are doing everything that they can. Staffing is the issue that comes up every time. Teams are not fully staffed, and even if they were, the waiting lists are so bad in many areas that you're going to have to hire more clinicians to clear the backlog. Not one of the CDNTs in the country, of the 91, were fully staffed, was the last we heard at the Disability Committee. I've consistently raised this matter with you, Minister, at the Children's and Disability Matters Committee through PQs. I've encouraged you and the HSE to look at different ways of recruiting staff. And staff are also deeply frustrated and demoralised. One of the respondents to the FUS survey explained, and this is a quote, "Vacancies are too long empty and it's just a revolving door. In order to progress, you have to leave your post. I'm just waiting for something to come up so I can leave." So of course frontline staff are burning out, transferring or going into private practice. And then as an example, in terms of ways this could be addressed, there is the persistent inequity in how Section 39 organisation staff are treated. How can anyone believe that the attempt is meaningful enough to address staffing issues when they continue to be denied pay parity? and the same working conditions, they have exactly the same working conditions as other people, and they don't have the same parity as jobs in the HSE. So we've identified that the staffing issue is the main cause. At the Disability Committee, at the Children's Committee, this is always what it boils down to. At the AV room events, everything. And then there's a concrete action that can be taken that's actually a drop in the ocean of a government budget, and it's not. The Social Democrats in our alternative budget proposed to increase the allocation for Section 39 organisations, TUSLA-funded Section 36 organisations, and for Section 10 homeless services by a total of 80 million as a first step in addressing this disparity. These issues start even earlier in healthcare professionals' career. Nurses are paid shockingly little for their placements in hospitals, but the situation is even worse for therapists, for psychologists and others, and I've raised this point with Minister Donnelly repeatedly. Minister, the government has to understand that the key to ensuring young people want to work in the Irish healthcare system is valuing them from day one. I really would welcome the motion's inclusion of the disability payment in the next budget. Last July, the Social Democrats had a motion calling for an increase of at least €20 per week as a very first step to addressing the cost of having a disability in Ireland, and to increase the disability allowance by at least €15 per week. So that's a total of 35. Instead, the government gave €12 more on core welfare payments and several once-off payments. While these provided some help, they did little to address the long-term systemic issue faced by disabled people. A one-off payment for a disability is insulting because in the vast majority of cases, it's 365 days of the year. So it's like acknowledging that it costs more, but only acknowledging it for a day. The government's own cost of disability report revealed that people with disabilities face up to 12,300 extra costs annually on transport, fuel, equipment aids, medical expenses and much more. And additionally, this report was before the current cost of living crisis. There is substantial additional cost to living with a disability in Ireland. This impacts on individuals and families' quality of life and also their future prospects. Most significantly, the social model of disability shows that this is a constructed barrier. Government policies and society make it more expensive to have a disability. It's up to the government to adjust that by providing a comprehensive and long-lasting solution. Government kite-flying about the budget has already begun. Before any tax cut would be even considered, there should be a firm commitment to providing a permanent cost of disability payment and to funding the massive staff shortages in disability services and healthcare more broadly. Similarly, the motion mentions the need to review the carers allowance and other income supports. I suppose, Minister, I could go on, Chair, there are so many issues. This is before for children's school places. We don't get to any of the other things. We need an all-of-government approach to this.
Deputy, are you sure?